Imagine a world where debilitating fatigue is no longer dismissed as just being tired. For the 400,000 Britons living with myalgic encephalomyelitis/chronic fatigue syndrome, ME/CFS, this could soon be a reality. A groundbreaking blood test, boasting 92% sensitivity and 98% specificity, promises to revolutionize diagnosis, offering hope for faster, more accurate identification and potentially transforming lives. But here's where it gets controversial. Can a single test truly capture the complexity of a condition that has baffled doctors for decades? And this is the part most people miss. While the test shows immense promise, it's not a magic bullet. Independent validation and careful integration into clinical practice are crucial before we can declare victory. After years of frustration and misdiagnosis, this new test, developed by researchers at the University of East Anglia and Oxford Biodynamics, identifies unique DNA folding patterns in the blood of individuals with ME/CFS. This innovative approach, utilizing Oxford Biodynamics' APSwitch 3D genomics platform, moves beyond symptom-based diagnosis, potentially shortening the diagnostic odyssey that many patients endure. Currently, diagnosing ME/CFS relies on ruling out other conditions and identifying hallmark symptoms like post-exertional malaise, unrefreshing sleep, cognitive fog, and autonomic dysfunction. This process can take months or even years, leaving patients vulnerable to skepticism and inadequate care. An objective lab test could be a game-changer, providing concrete evidence to support diagnoses and pave the way for tailored treatment strategies. But how does it work? The APSwitch technology delves into the intricate three-dimensional architecture of DNA within cells. While the genetic code itself remains constant, the way DNA folds and interacts with regulatory elements changes in response to disease and inflammation. The test identifies a specific pattern of these 3D genomic markers that appears consistently in individuals with ME/CFS. A standard blood sample is processed to capture these structural signatures, and a trained algorithm classifies the sample as consistent with ME/CFS or not. Importantly, the test doesn't assess disease severity or predict outcomes. It simply detects the presence of a molecular fingerprint associated with the condition. Why is this diagnosis so crucial? ME/CFS is a debilitating condition characterized by profound fatigue, post-exertional symptom flares, orthostatic intolerance, pain, sensory sensitivities, and cognitive impairment. Many individuals are forced to leave work or education due to the severity of their symptoms. Without a definitive test, patients often face disbelief, delayed access to benefits, and limited treatment options. A lab-backed diagnosis could revolutionize how GPs approach ME/CFS, how employers accommodate affected individuals, and how insurers evaluate claims. For patients currently waiting years for answers, a validated test could condense the diagnostic journey into a single blood draw. Early diagnosis also benefits research. By identifying clearer study cohorts, researchers can accelerate drug development and biomarker discovery. With the rise of post-viral fatigue syndromes following the pandemic, the need for reliable diagnostic tools has become even more urgent. However, caution is warranted. While the initial results are promising, independent replication is essential. Researchers need to demonstrate the test's effectiveness across diverse populations, including different age groups, ethnicities, and disease severities. They must also compare its performance against conditions with similar presentations, such as long COVID, fibromyalgia, POTS, depression, anemia, and hypothyroidism. Key questions remain: does the test perform equally well in primary care settings as in specialist clinics? How stable are the markers during disease relapses and remissions, or after infections and vaccinations? How does medication use impact results? What are the turnaround times and costs in routine NHS laboratories? What does this mean for patients and doctors? If validated and approved, GPs could incorporate the test into their diagnostic toolkit once other red flags are ruled out. While not replacing clinical judgment, the test could guide earlier interventions, such as pacing strategies, symptom-targeted care, and referrals to specialists. For employers, a biomarker could simplify the process of implementing workplace adjustments. However, cost-effectiveness will be closely scrutinized. While the test's high specificity reduces the risk of misdiagnosing healthy individuals, its 92% sensitivity means some cases may still be missed, requiring clinicians to remain vigilant and consider repeat testing if suspicion persists. Let's break down the science. Imagine your genome as a long thread. Cells fold and loop this thread, allowing distant sections to interact and regulate gene activity. Diseases like me/CFS alter these folding patterns. The test detects this altered posture of the genome, much like reading body language rather than a birth certificate. It doesn't change the underlying DNA sequence but identifies the unique way it's arranged in me/CFS. What you need to know now. The test is not yet available in the NHS. Wider validation and regulatory approval are necessary before rollout. A positive result supports a diagnosis when combined with clinical history and examination. A negative result doesn't rule out me/CFS. Clinicians may retest or reconsider the diagnosis if symptoms persist. Keeping an activity diary can help track post-exertional malaise and provide valuable information during appointments. Participating in ethically approved studies can accelerate validation and access to the test. Understanding accuracy. While 92% sensitivity and 98% specificity sound impressive, context matters. In a general population where me/CFS is rare, even a small false positive rate can lead to many incorrect diagnoses. For example, in a population of 100,000 adults, if only 0.6% have me/CFS, the test would correctly identify around 552 true positives but also generate approximately 1,988 false positives. In specialist clinics where the prevalence is higher, the proportion of true positives increases significantly. This is why clinical judgment remains essential, and the test should be used alongside a thorough history and examination. Looking ahead, biomarkers like this have the potential to do more than just diagnose. Once validated, they could stratify patients into subgroups, guide clinical trials, and monitor treatment responses. The 3D genomic signature might help differentiate between post-viral immune phenotypes and autonomic dominant cases, opening doors to personalized therapies. Researchers will also explore whether similar patterns exist in long COVID, which shares some features with me/CFS. If overlaps are found, the test could shed light on the shared and distinct biological mechanisms of these conditions. For those considering private testing, proceed with caution. Unregulated tests can be costly and lack clinical validation. Waiting for peer-reviewed evidence and clear clinical guidelines can prevent confusion and financial strain. In the meantime, patients and caregivers can prepare by organizing medical histories, documenting activity limitations, and discussing flexible workplace adjustments to minimize post-exertional crashes. If the test becomes widely available, being prepared could translate a lab result into practical support within days, not months. Now, let's spark some debate. Is a blood test enough to capture the complexity of me/CFS, or will it oversimplify a multifaceted condition? How can we ensure equitable access to this test, especially for underserved populations? Share your thoughts in the comments. Let's keep the conversation going.